Uh, so this has been one of the things that we focus most on in the management, in my management role, trying to look after junior doctors, understanding that this is going to be a huge time of transition for most junior doctors. So making services available. So in the hospital for the doctors in training, we started up a weekly drop-in session with senior management staff. So any doctor in the hospital could come and sit down and talk to someone else about their problems, whether that be the medical director of the hospital in some cases, or whether that be the director of education, or even clinical development fellows who are trained in listening to people to help them through some of their issues. Additionally to that, we've had well-being boxes sent out to the wards. These have included things like hot chocolate and socks and things like that, just to get people feeling a bit better about themselves. It's been a nice treat when those come onto the wards. Rest places has been a bit of a challenge. One thing that junior doctors always say is that we never have enough or adequate spaces for rest. So at the Western General, we still don't have a doctor's mess in the hospital. We're not allowed to eat in clinical spaces, and we're not allowed to eat in the doctor's offices, but we have no office to go to. So we're supposed to eat outside, and in Scotland, that's not always the most sensible thing to do. And so either it's break the rules, or wear a jacket whilst you're eating lunch. So we've had to advocate quite strongly for better rest facilities, and in some aspects that's been actually remarkably successful. So at the Royal Infirmary, there was an initiative where furloughed airline staff would come into one of the big seminar rooms, and they would be there from something like 8 o'clock in the morning right up until 8 p.m. They would do shift work, so 4 hours, and it would be a space that any doctors, nurses, clinical support workers, literally anyone working in the hospital could come to and have free hot drinks, free soft drinks. There was pizza at certain times of day that was funded by airlines. And it was just a great opportunity to chat with, cabin staff. I chatted with first officers, second officers, pilots, everyone. And it was actually really nice to hear their perspective, because, I think sharing stories is incredibly powerful. And I think hearing the plight of other people was incredibly interesting. One thing that I had no idea about, which was speaking to some of the Ryanair staff, were that whilst EasyJet and Jet2 staff had been furloughed and were paid by the government, I think it was Ryanair who had, just before the pandemic, were going into liquidation. Now, they had 3 or 4 potential buyers lined up just before the pandemic hit and during the early stages of the pandemic. But because the government said they were going into liquidation and thought that they were not going to be a viable company coming out of the pandemic, they'd actually declined to pay any of the staff from Ryanair on the furlough scheme. So there were pilots essentially from Ryanair, first officers, who were having to go on to universal benefits, which seemed incredibly challenging, when you have a family of 2 or 3 children that you have to look after. So I think it was interesting to hear the plight of other people, and it was just a nice space for us, all hospital staff, to kind of mingle and chat about the experiences.